Good morning, and thank you for coming out in this wonderful rain. I am Jake Halliday, and together with my colleague, Rebecca Rohn, I am the director of the Coulter Translational Partnership Program at the University of Missouri. It's my pleasure to welcome you to this celebration of our program's first round of funding awards. MU's Coulter Translational Partnership is designed to help research become attractive for investment and ultimately commercialization so that it can benefit patients and reach society. The awards we're announcing today will provide what we call bridge funding. By that we mean we've identified projects that have excellent market potential, tremendous benefits to patients, but need a little bit more investment to help advance through the later stages of the translation process and reach patients. Several people, many people, have made this program and this celebration possible. I'd certainly like to thank MU Chancellor Brady Deaton, School of Medicine Dean Bob Churchill, MU Engineering Associate Dean for Academic Programs, Robert So. And last but not least, where's Jing Lu? I'd like to recognize Jing Lu Tan. Jing Lu is the principal investigator on the external grant that accompanies this partnership, and he's also the department chair of our Department of Biological Engineering, a department that's a little unusual in that it is part of both the College of Engineering and the College of Agriculture, Food, and Natural Resources. Other important participants with us today include the co-investigators on this program, Jerry Parker, who is the co-director of the MU Institute for Clinical and Translational Science. Jerry's here. And Chris Fender, who is the director of MU's Office of Technology Management and Industry Relations. I'd also like to thank Rob Duncan, Vice Chancellor for Research, and Jamal Ibda, co-director of the Institute for Clinical and Translational Sciences, for their support. I'd just like to do a check. Are there any elected officials with us today that I'm not noticing in the group? But we do appreciate that team that works hard for us all in Jefferson City and indeed in the capital. Being selected as a Coulter Translational Partnership campus places the University of Missouri in a very elite group of institutions that includes universities such as Johns Hopkins, Stanford, and Duke. To tell you more about this important distinction for MU and explain how we achieved it, it's my pleasure to welcome Chancellor Deaton to the podium.
Jake, thank you very much, and let me add my good morning and welcome to all of you for joining us on what truly is a special occasion. We're celebrating the first 5 research projects to be funded by the university's partnership with the Wallace H. Coulter Foundation. And you're going to have an opportunity as we go along here to learn more about these individual projects. But I want to emphasize to you very much, as Jake has already stated, why our university takes such great pride in this $5 million award from the Coulter Foundation. Now, this partnership funding is significant, and it's a real distinction for the university to achieve this status. And the company of universities that were mentioned earlier just gives you some example of that. It's a highly selective process. When the Coulter Foundation picks its partners, they're looking at all dimensions of the university. And the terms and conditions for serving in this partnership, you might say, as a university, is a rigorous process, one we respect, and one that respects the academic quality, breadth, and depth of our university. And we can really celebrate the fact that we are among only 15 universities in the country and the only university in the state of Missouri to be selected to establish a Coulter Translational Partnership Program. And I would like to ask that we give a round of applause to the wonderful administrative team and particularly the strength of our faculty that has led to this distinction. You all deserve thanks. The Coulter program that we're going to hear about today expands on the University of Missouri's unique existing resources and strengths that have been developed over decades here. And it's important, I think, that we all understand that. MU is one of very few universities in the nation with schools and colleges of medicine, engineering, nursing, health professions, veterinary medicine, agriculture, business, and a comprehensive academic medical center all on the same campus. MU's Biodesign and Innovation program that has already helped patent new medical technologies while supporting education by creating teams of students in medicine, engineering, and business is a further hallmark and a synergism that's been created here in a very planned way to take advantage of these strengths. And those of you that have not had a chance to look more closely at the MU's Biodesign and Innovation program, I invite you to pursue that topic with our faculty here in medicine, engineering, and business, all of whom intimately involved. I've sent a number of people over to look at it because it's so exciting. Our nuclear research reactor certainly is one of the very unique assets we have that contributes to the development and provision of radiopharmaceuticals and is critical in this process. The Mizzou Advantage and its One Health, One Medicine initiative, very critical to our strategic direction as a university, as well as MU's Institute for Clinical and Translational Science that Jerry and Jamal were recognized a moment ago for leading, are also very important in turning these discoveries that we engage in across the spectrum of science and engineering and technology here at the university into new methods of treating, preventing, and managing diseases, so that this theme of serving the patients of our health system is very critical to what we are all about today. I could go on and list a number of other programs that support our translational research endeavors because all of them are very important to this funding and to the recognition that comes nationally to being a Coulter partner. We have heard about this partnership from others across the university community, across the nation, because it is so distinguished and it brings such distinction to us. These are the same characteristics that lead us to be recognized as a very important member of the Association of American Universities, one of only 34 public members of that very elite group of universities. It also is important to our being named a research-intensive university by the Carnegie Foundation. These kinds of distinctions and classifications help show the world what this room already knows, and that is that MU is deeply committed to focusing its outstanding resources across these various dimensions of scholarship and research and technological development to advance biomedical discovery and innovation. And we can only do that when we have a strength of faculty and a commitment on the part of our scientific strengths here at the university with students, faculty, and postdocs working in teams with directors and the administrative leadership here to bring all this to fruition in a very targeted way and to ensure that the quality of patient service is improved over time. So the faculty strength I want to call attention to, and you will hear more about that here next and in the future discussions this morning. And I want to call on Dr. Jinglu Tan, who's been introduced already, to come to the podium to announce the first teams of scientists who will be receiving funding under the MU Coulter Partnership Program. Dr. Jinglu Tan.
Thank you, Brady. Thanks to everybody for joining us today on a nice rainy day. It's my pleasure to announce the first 5 teams of engineers and physicians who have received funding from the MU Coulter Translational Partnership Program this year. Each team includes 2 investigators, 1 engineer from the College of Engineering, and 1 clinician for our School of Medicine. And this year, the engineers receiving the awards happen to be all affiliated with the biological engineering department, but that's not by design. And the clinical investigators are from various different departments in the School of Medicine, including pediatrics, trauma surgery, orthopedic surgery, and pathology. The projects all went through a very rigorous review process by a committee of entrepreneurs, accomplished researchers in engineering and medicine, and VC fund managers, and senior advisors at major medical companies, etc. Each project must demonstrate a outstanding scientific merit and also must show great potential to meet a well-defined unmet clinical need. That was a requirement. I will introduce the project teams by naming the engineering investigator first and then the physician investigator. The first team of awardees is Drs. Andrew Gu and Michael Wang. They are developing an accurate, inexpensive, and non-invasive nanotechnology for measuring the effects of lung cancer therapies. The method could also be used for other forms of cancer, heart disease, diabetes, and even psychiatric disorders. Dr. Raghu Cannon and Jerry Arthur, who are sitting here, are also developing a tool for cancer patients. But their detection kit initially will focus on colorectal cancer. Like the first technology, theirs is also a nanomedicine-based method that could be used ultimately to provide a more effective detection for other forms of cancers. Drs. Sheila Grant and Rick White, they're sitting there, and are developing a novel tissue-engineered anterior cruciate ligament, or ACL. I have trouble seeing those words. And this new tissue graft is designed to integrate better into the joints while lasting longer and also having better functionalities than what's available on the market today. Drs. John Vieter and Steve Barnes are creating a very exciting new way to measure, to help burn victims by using a technology called photoacoustics, that is using laser to induce ultrasound. Their new instrument could measure the depth of a burn wound accurately and non-invasively, and thereby allowing the patient to retain as much healthy and viable tissue as possible. Our final team is Drs. Gary Yao and Judy Miles. They're sitting here. And they are developing a new technology for early detection of neurodevelopmental disorders in children, such as autism. And this technology uses a methodology called pupillary light reflex. That is the response of pupils to light stimulation. And as we all know, early detection for a lot of these diseases, early intervention is critical. So this technology could be used for other, a wide variety of neurological disorders. Now finally, with all the newly funded investigators, please rise and be congratulated one more time. There's Michael Wang. Please be seated. Now it's my pleasure to invite to the podium a very important supporter and partner of this program, Dean of Medicine, Dr. Robert Churchill. Bob.
Well, thank you. Thank everyone for coming here today. We only have one nasty, uninvited guest that showed up, and we're keeping that person outside, and his name is H. Isaac. And so we need the rain, but whatever. The fact of the matter is, we were in here about a month ago when we announced a $13.3 million grant. That was the biggest grant in the history of the medical school. And it's something I virtually had nothing to do with, but yet I was the one that was asked to speak. Today is kind of a similar event. I really virtually had nothing to do with this. I'm happy to take part of the credit and to speak for those that were really responsible for bringing this home. I want to mention Dr. Bill Caldwell, who is not here today. His lovely wife, Jerry Doty, is. But Bill was one of the three on the team of Chris Fender and Jing Liu, and to really push this forward through the national competition. And, and Jerry Parker has nicely stepped in after Bill retired. Bill is a retired full professor in the Department of Pathology and Anatomical Sciences. And he was center director for the Ellis Fischel Cancer Center for about the last decade before he retired. And so I'd like to give Bill a round of applause, even though he's not here. One of the nice things about not being first to talk is that most people covered everything that I was going to talk about. And so rather than repeat it, I'd just like to congratulate everybody. Next month, we are going to be opening a brand new clinical research center, highly advanced, in the School of Medicine. And so the timing is right because this will really have advanced testing capabilities for new devices and new treatments that hopefully some of these projects will be tested in that site, sometime in the future. So again, I'd like to, congratulate all the newly funded awardees and thank everybody for coming. And now I'd like to call to the podium Dr. Zhou.
Being the last has its privilege that I can, first of all, speak as long as I want, and I plan to finish this before 2 o'clock this afternoon. And another good thing is that I don't have to worry about introducing another person. Okay. After you hear all this good news and very encouraging accomplishment, I'd like to share with you about some story that I recently learned about the Wallace H. Coulter, okay? I want to take a moment first to explain further why the Coulter Foundation and MU are so interested in supporting teams of engineers and physicians to advance biomedical science. Let me begin with the story of Wallace H. Coulter himself, who was an engineer, inventor, entrepreneur, and visionary. Mr. Coulter was the co-founder and also the chair of Coulter Corporation, a worldwide medical diagnostics company headquartered in Miami. That's where the rain comes from. So timing is good. Now, his passion for applying engineering principles to scientific research led him to invent the Coulter principle, which is a reference method for counting and sizing microscopic particles suspended in the fluid. He also was a founding father in the field of laboratory hematology, which is the science and the study of blood. It might also be interesting to note during this time in our nation's economy that Mr. Coulter was unable to complete his college education due to the Great Depression. But from a laboratory in his own garage, he launched an amazing career in biomedical engineering. We're fortunate to have many more resources than Mr. Coulter had early in his career. But I believe our scientists share his same passion for discovery, innovation, and collaboration. In fact, while collaborations among engineers and physicians aren't new, they have never been more important. Now, engineering has contributed immensely to some of the greatest advances in modern medicine, from improved imaging devices to the bioinformatics tool we use to mine data from DNA. The research is advancing each day at MU's College of Engineering, where scientists are developing everything from laser technologies to mobile phone applications to arrive at solutions for improving human health. The next Wallace H. Coulter might be right here in this room, or busy working in his or her lab at the MU's Bound Life Science Center, nuclear research reactor, or elsewhere on campus. Some of our university's most promising teams of engineers and physicians are now newly founded Coulter investigators. Congratulations to each of them on this accomplishment. Like all of us here, I look forward to watching their research develop into actual products and services that could improve the lives of patients at MU and around the world. Thank you very much.
I'd like to thank everyone again for joining us to celebrate our awardees in our first round of bridge funding in the program, and I certainly invite you to stay a while, enjoy the refreshments, visit with the investigators and with the leadership of the program and the campus, and learn more about translational research at the University of Missouri. Thank you.